Thanks so much, Rob, and thanks a lot for having me today. It's a great pleasure speaking with you today, and thank you for continuing the conversation that we all started during the pandemic. So yeah, Unitaid is a global health organization that was established in 2006 and is hosted by the World Health Organization. To explain it in a few simple words, we save lives by making new health products available and affordable for people in low and middle income countries. That means that we work with our partners to identify innovative products, be that diagnostics or therapeutics or even preventative tools, and then address the market barriers that hinder their use and their adoption in low and middle income countries, so that we can get those tools to the people that need them most, and that as quickly as possible. Since 2006, we have helped to introduce more than 100 groundbreaking health products that benefit more than 300 million people every year. So clearly, we're taking the exact same approach when it comes to our work on medical oxygen. And there, it's pretty much the same situation as for the Every Breath Counts Coalition that Leith already mentioned. We basically built on our expertise and experience in infectious diseases when we saw the terrible images of the early days, especially of the COVID pandemic, and decided to really get started with our work on medical oxygen during the pandemic. We took a leading role in the Unitaid partnership that Rob and Tom already mentioned, and led the Oxygen Emergency Task Force, which Leith already described, that mobilized that famous $1 billion. And individually, Unitaid invested more than $80 million in more than 10 projects in 51 low and middle income countries in medical oxygen. So in the early days of the pandemic, we really focused on delivering the emergency oxygen and oxygen supplies to meet those surge needs and demand during the pandemic. So we procured and delivered concentrators and cylinders and pulse oximeters, and even installed or repaired PSA plants just to get the oxygen to the people that needed it. And then when we started to transition out of the pandemic, we also we kind of shifted the focus towards strengthening the long-term stability of oxygen supply and oxygen equipment. For example, by negotiating two unprecedented agreements with major industrial gas companies that help to lower the prices for liquid oxygen by more than 20%, and for cylinder fillings by more than 40%. We also provided technical support to local to national health systems to build their resilience, their local capacity, for example, by training thousands of healthcare workers and biomedical engineers, or supporting the development of national guidelines of training materials in a lot of low and middle income countries. And then, of course, we also supported and promoted the identification and introduction of innovative oxygen delivery systems, such as an oxygen blender and bubble CPAP device for newborns, or the testing of the impact and efficacy of new pulse oximeters. So once the pandemic was declared over, of course, Unitaid continued and is still continuing to be a global leader in establishing sustainable, equitable access to medical oxygen in low and middle income countries. Oxygen is now part and parcel of the current strategy of Unitaid, and we keep working with our partners, with governments, with communities, with civil society, with industry, and to support countries in addressing the current health challenges that they're facing, but also, as Leith mentioned, to be prepared for any future emergencies or needs that may come up in the future. We do that by continuing to take a leading role in the global coordination and collaboration, by co-chairing the Global Oxygen Alliance that was already mentioned as well, but I think we'll get into that a little bit later. So I'd just like to give you one brief example of one of the most recent investments, for which we teamed up with MedAccess, which is a UK-based social finance institute. And together we work with regional manufacturers in sub-Saharan Africa to build the regional local manufacturing capacity for bulk liquid oxygen to ensure a more sustainable, more secure, more equitable supply in that region. Why liquid? Because it offers a range of advantages over other production modalities in terms of efficiency, in terms of reliability, the energy use, the storage, the ease of use is much better. And it also offers a higher purity. So liquid oxygen is considered the best in class or the standard of care in high-income countries. So if you needed oxygen, say in the UK or here in Switzerland, what you would get is liquid oxygen. And what we're trying to do now is to get that standard of care as well to patients in low and middle income countries.